Good morning, top of the morning to you. I'm checking 10 minutes past 10. This time, Friday, Monday, like I've been today. This is the day of the month of October. We are about getting to run. It's Sunday, you know, I plan next month is November, but you get it. Okay, let me say, it's Christmas Day. So, what plans for Christmas? Your plan for Christmas, make sure that you try to stay healthy. It's not it will see everybody that's here out to the kids. We all ourselves. Okay, you're Women Radio BFM 917. So your health consultation program where real doctors, real people. Real Doctor is Nigeria's specialized program where medical doctors consult for free and advice basically on Women Radio. It's broadcast from Monday to Friday to 11 a.m. My name is Abiola, and our radio doctor for today is Dr. Abiola, the MO of ROA Specialist Hospital. Good morning, Dr. Abiola. How are you this morning?
Good morning. I'm doing great. It seems like we're having a little delay in the connection. Can you hear me well?
I can hear.
Okay, good.
Okay, you hear?
Happy Friday. You're a little bit choppy, but as long as you can hear me, that's fine.
Oh, really? You can't hear me?
I'm sorry?
Can you hear me properly?
No, it's like the video is choppy and your voice is choppy.
Let's my network connection. Let's see if is this better?
Yeah, it's a little better.
Okay.
Yes, it's better.
Okay, let's see how it is. Okay, how are you? What? Happy Friday, happy. What is it now?
It's Happy Friday.
Happy Friday. What are your plans for the weekend?
In the U.S., October 31st, especially on a Friday, is Halloween.
Oh,
so,
yeah.
This is when you go trick-or-treating and all that. So this weekend, I'm going to watch Halloween movies with my kids and introduce them to the concept. So maybe watch a scary movie. My son doesn't like scary movies, but we're going to watch a little scary movie.
No, I don't do scary movies. I am sorry. Could never be. Never. You couldn't catch me dead watching that. Even normal movies that are a bit, like thriller movies that are a bit, tense, fast-paced. I'm going to Google to check what the movie is about. I don't have time. Even romance, what? I will not try myself to watch a scary movie. No. Miss me with that. We're not doing that at all. We are not. Anyway, thank you for coming on the show.
My pleasure.
Yes, thank you for coming on the show. You can listen to us from any part of the world you find yourself in, www.wfm917.com. You can also watch us live on YouTube at WFM917. Okay, let's get into it. Today, we are going to be talking about understanding stroke. Understanding stroke. Stroke is a silent killer. If you don't know. Interestingly, on the show we had before this one, Her Lens, one of the ladies on the show was talking about how she went for, I think she said yesterday was World Stroke Day or something, and she had gone for an event, and at the event, there were different people talking about how they had stroke, how sometimes it's not planned, how sometimes it's not planned. Sometimes they know, sometimes they don't know. It just so happens. So today we are going to be talking about stroke, especially in a country like Nigeria that stress is our middle name. Let's not lie. Like the moment you leave your house, the chaos is meeting you. This is not even a thing of negative confession or anything like that. It's just what it is. The moment you leave your house, you're in the car, maybe you're in a public vehicle, something is about to hit you. Chaos and noise. So that's what we're talking about, stroke today. So doctor, let's begin simply with what exactly stroke is. Let me start with that one. So what is stroke? Let's just start with that.
Yeah, a stroke happens when blood flow to a part of your brain is cut off or blocked. And or it can happen when the blood supply to a part of your brain is either blocked or a
Yeah.
blood vessel in that area bursts.
Mm.
Right. And one of the reasons why I was happy to have this topic is, of course, World Stroke Day. But I've been seeing a lot more strokes in my clinic lately. And so this
Okay.
is it's a very poignant topic. You have two main types of stroke. You have something called ischemic stroke, which is like a blood clot, and that's the most common type. In the States, that's about almost 90% of strokes are ischemic strokes. And then you
Okay.
have something called hemorrhagic stroke, which is a bleed from a ruptured blood vessel. And we'll
Yeah.
throw one more category in there. You have something called a TIA, which is transient ischemic attack. It's like sometimes called a mini stroke, and it's where like the person's symptoms may resolve within 24 hours. But in here and around the world, people take that as no stroke, but it just means that a full stroke may be around the corner.
Right. Okay, so what exactly happens in the brain when someone experiences stroke?
Yeah. And let's give some numbers for the listeners. There's over 200,000 strokes in Nigeria a year. It's a stroke every couple of minutes.
Whoa.
In the States, there's a stroke every 40 seconds. So in Nigeria, I think it's about like every minute and a half to 2 minutes there's a stroke. So this is not something small that we're just talking about.
Yeah.
When you're trying to talk, like your question said about, maybe a little bit more descriptive on strokes, people usually do minor versus major. They're not talking about a different disease. They're just talking about the severity. So some people can have a stroke and the whole one side of their body will no longer work, and some people can have a stroke where I saw a lady last week, and I immediately looked at her. I'm like, "You're having a stroke." How did I know? I just saw her forehead, and just from her forehead, I'm like, "You're having a stroke." What's her blood pressure? Her blood pressure was like 200 over something. I'm like, quickly do this. Just from her eyebrows. One eyebrow, when she would talk, would move, and the other eyebrow wouldn't move. And I'm like, "Oh, she's having a stroke." That was all. That was all. And this is just last week. So we quickly got her on some medications and, brought her blood pressure down safely and, worked with physio. But if we had not noticed it quickly or have just left her, it could happen like the whole side of her body could be paralyzed. And a lot of times, if you don't act fast, it could be paralyzed forever. I'm sure a lot of us have seen somebody dragging, a leg or dragging an arm, and you wonder what happened. More than likely, that was from a poorly treated stroke. Globally, it's the second leading cause of death. This is a serious problem, but I like how you said silent, because a lot of people don't pay attention to it. And they don't pay attention to what causes it, and then you have it.
Because I was just going to even preempt myself to say that obviously a lot of people don't even know, because the lady that you attended to did not even know that she was having a stroke.
Mm-hmm. She had no idea. She just came there because she had a headache. And it was more than a headache.
So there are no warning signs before it happens? Or
yeah, the classic stroke starts suddenly, either from the blood clot or the bleed. But so I would say two-thirds of people that have stroke really have no warning sign, but a third of them have warning episodes, and that was what I was talking about, TIA. So it's a brief stroke-like symptoms that come and go. And they may happen in the hours or the days before your actual stroke. But sadly, most people ignore them. Historically in Nigeria, something happens like that, we want to watch and see will it go away. And if it goes away, they're like, I've escaped that one, not knowing that was that was a warning for you to go and get a checkup. But it can happen. It can happen suddenly. If you can pick one of the brief ones, some of the things, and we'll talk more about this later, I'm sure, but you have a sudden facial droop, or you have a sudden arm weakness, or you have speech trouble for some time, loss of vision, imbalance, or even a terrible headache. even if they fade, these are emergencies. Right? So even if the symptoms get better, you need to rush to the hospital. See a doctor like me and get a checkup, because it's just a matter of time before the big one hits.
Huh. So just to go back to the lady that you attended to, how much time how much time is there between, a patient or an individual having stroke from maybe serious brain damage to actual stroke? Is there a time frame? Because you had said in that case, thankfully, you happened to be there. But what would have happened if no one was there? Is there a time frame, or it just happens? I know you said suddenly, but is there a time frame from when the TIA is happening to an actual stroke?
That's a very good question. I like to answer with some statistics.
Okay.
So you're having a stroke, you're going to lose about 2 million brain cells a minute. A minute. Every minute you're losing 2 million. And those cells don't regenerate. So you've just lost them forever. If you are able to treat somebody within 4.5 hours of their stroke, you have like a 90% chance of making their life better. Let me just put it that way. So that's why we really want to emphasize that you have any of these symptoms, go and get checked out immediately, because if it is a stroke and we catch it quickly, less than 4.5 hours, you have a great chance of recovering. You even have another window, 6 to 24 hours, where you can also make some different. If you can get treatment within 15 minutes, it's almost 99% that you'll have better, survival rate. But in Nigeria, about less than 10% of people show up on time. There's been studies, and I read the research. Less than 10% of them show up on time. But you're right. Now, between the brief stroke or the TIA and the major stroke, it's honestly how bad your disease is, and let me say God that decides. It could be a few hours before the big one hits. It could be a few days. It could be a couple of weeks. But the one thing we can guarantee is that if you're left untreated, you will have a proper stroke. You will have and it could be as short as a few days later.
Okay. Wow. Even me, I'm quiet. Okay, so what is that's scary. What is the leading cause of stroke in Nigeria in particular? And then who's more at risk? Is it women? Is it men that's more at risk of stroke in Nigeria?
Yeah, so, it's important to know anybody can have a stroke. But the number one driver in Nigeria and worldwide, same thing, high blood pressure.
Right.
Number one. And I would say poorly treated or untreated high blood pressure, number one cause of stroke. It's not even close. Number two would be, I put all these into one category: diabetes, high cholesterol, being fat, obesity, smoking, sickle cell. All of those I put into one category because they involve your vasculature. And then we're also talking about people at risk, so a diabetic is higher risk for stroke. A person that has high blood pressure, whether it's treated or not, is at higher risk. Those people that eat poorly, drink excess alcohol, have stress all the time, you're at a higher risk for stroke. Women, this is WFM. Women are at a higher risk during pregnancy and during the period after pregnancy. And there's a small added risk for those taking birth control pills too. They are at a higher risk for stroke, especially if you smoke with them or you have high blood pressure. So for adults, high blood pressure was about 40% of Nigerian adults had some form of either hypertension or somebody in the family that had it, and less than 10% of them knew that at the time of the study. So it's a serious issue.
You mentioned birth control pills. It's just the pills, not like contraception in general, right?
No, it's any contraception, or any contraception that has estrogen. It's the estrogen that increases your risk of stroke, and
So the
it's more.
contraceptives I know,
Mhm.
implant, IUD, IUI, the injection, and then there's one more.
So
The
because of the
pills.
stroke risk, all the Implanon, the injection, all those are progesterone only. So they don't
Right.
put estrogen in them. Right.
Okay.
The only time that you would commonly get estrogen in a birth control pill is the daily tablet.
Right.
That
Right.
daily tablet has estrogen and progesterone. But typically the Implanon or the injection, the 3-month injection, those are usually just progesterone.
Okay. Okay. Got you. Got you. Okay. Now, someone has a stroke, right? In the case of lady, I'm sorry, I'm going to be mentioning her a lot because that was
No, I
that
don't mind. Mm-hmm.
example. Now, but in her own case, she was already in the hospital, and thankfully, she had a great doctor like you to be able to
Hey.
to be able to notice, right? Um, what if she was home? What what should be done immediately before getting to the hospital? So somebody is noticing. I know that you had mentioned when your words are slurring. I typically would be like, oh, why your words? Are you okay? Are you okay? Are you okay? So if the words are slurring, because you mentioned certain things that certain symptoms, these symptoms, yes, that you would notice when a stroke is about to happen, right? What should a person do, a loved one, a family member do, a colleague at work do when they notice that maybe the face is drooping, the hand is drooping? What should they do right there? Do they leave the person? Do they carry the person to the hospital? Because I know that sometimes they say, "Oh no, leave the person might be da 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 da." But what's the first response to make that would actually make a difference for the person?
Yeah, so that's a very good question. In medical school, everything was about acronyms. So there's an acronym BFAST, which is balance,
Mm-hmm.
eyes, face, arm, speech, time to act. And I'll explain them. So if you notice your coworker suddenly becomes unsteady, if you notice that they suddenly have vision loss or double vision, if you notice that their face is drooping, you know, if you notice that they have arm weakness or speech difficulty, it's time to act. And in Nigeria, do you know we have an emergency number? Like in the U.S., we dial 911.
Yeah.
In Nigeria, we have 112. I don't know if it works. I've never tried it, but we have an emergency response. But all jokes aside, once you notice that, don't give them water. Don't pour water on their head. Don't give them anything to eat. Note the time, like the time that they were last okay, and
Mm-hmm.
then rush them to a hospital. That's just the best advice. Just get them to a hospital so that they can be evaluated. You remember, your number one cause is high blood pressure, so you want
Mm-hmm.
somebody to check the blood pressure in the hospital. If it's high, start bringing it down. Number two cause, diabetes. They're going to check blood sugar. So you just need to recognize this. The best thing you can do as a family member or a colleague, recognize the signs and know that just put this person in a car and take them to a decent hospital.
Okay. Now you
But
mentioned that.
recognizing the signs is important, and not sitting and seeing if it's going to go. Those are the two most important things. Don't sit there and see if it's going to get better. Recognize the sign and act.
I know that religion plays a huge role in this, where you're like, oh no, she, God healed and everything. And I'm not even against people's faith and whatnot, but in a country like Nigeria, where people are very, very steeped in their faith, how do they balance? Because I've actually seen situations where somebody is sick, or needs first aid ASAP, but we're praying.
Yeah.
How do we balance it?
With program, honestly, you're correct to identify that. With programs like this, getting the awareness out, teaching people statistics. We just have to change the culture one person at a time. Like I've had this question, I've wrestled with this question in my head for years, and it's frustrating all the kind of things I've heard. I recently lost somebody close to me that had heart failure, put him on some medication, and then he got better. And then one pastor told him, I see that you don't need this medication again.
Oh, Lord.
And he stopped using it. And of course, a week later, he's back on the emergency ward, and he didn't make it.
Already too late. So,
yeah, it's just why when you were in a bad shape, you got put on medication, the medication was working, you went back to work. Why would you stop without talking to the doctor? Somebody just comes out of the blue and says,
an unqualified person at that.
Oh, no, thank you, and just said God showed him that you don't need the medication. Really? It happens. It happens. It just happened to me a few months ago. This is somebody that was in my family. It's just.
I'm sorry.
It just. Thank you. It just. In your Bible say koyemi. It doesn't make any sense. I just don't get it. So all I can do is just try and educate the public.
Right.
I'm pleading with them, like, please do not do this.
Okay. Can a stroke, you had mentioned that if it's detected early enough, 90%, that was the number you gave. But then what happens when it's not early enough? Is the damage permanent once it has happened?
Yeah, so, remember we talked about two types of stroke. One that's a blockage and one that is a burst blood vessel. So, first of all, you need to, even though the blockage one is the most common one, is about like 9 to 1 ratio, you do need to do like some tests to be sure of it. Sometimes I do guess because the person cannot afford the test. It's called a CT scan or an MRI, but it's better not to. It's better to know exactly what you're dealing with, because if it's a blockage, you can give drugs, either injectables or oral drugs to break up the blockage. But if you give those same drugs to somebody that had a burst blood vessel, you just make the problem worse. So I know you asked how much time or what happens if you don't get to them on time. It really depends on what region of the brain was affected.
Okay.
So I have some stroke victims that I treat. I treat a lot of stroke. I wish I treated less, but I treat a lot of stroke. When it happens in a place that, let's say, is responsible for speech, then that person may have difficulty expressing themselves for some time, and it's going to take therapy. It's like I said, those brain cells will never regenerate, but you can form new pathways around the damaged area by repetitive training. But if the person can't afford the training or can't afford the physio or the therapy, then there may be stuff like that. Same thing goes for if it happens in what they call a motor center of the brain, like a part that controls muscles. If you don't get to it on time and the person has a deficit, meaning like their arm is weak or their leg is weak, you can improve that with repeated therapy. But if you don't get the therapy on time, every month that goes by that you don't start the therapy makes it 10 times harder to get any function back. So I see somebody that finally met me 3 years after a stroke and their leg is dragging. It's going to be very hard for me to restore function.
Yeah.
But if I get somebody a month later, it's outside of the window, but it's going to be easier for me to get them back at least closer to where they were before if we start working early.
Okay, so let's just expatiate on some of the long-term effects that stroke survivors deal with. You mentioned the speech slurring of the speech, dragging your leg, dragging your hand, and there are other ones. And then how can families support their recovery? Because, of course, I would expect that it would take its toll as well on the family.
Yeah, that's true. So the long term, you may have face weakness, and how would that look? Like if somebody smiles and only one side of their mouth, curls up, or they frown and only one side, or they, wrinkle, furrow their brow and only one side. Like you can have that long term effect. You can have paralysis, which is the dragging of the leg or dragging of the arm or both. even memory loss. We've had studies that show that dementia, it could be related to
Right.
multiple strokes over what we call lacunar infarcts over and over and over again. Person could have a personality change. Depression is part of it, or personality change. They could just become bipolar or manic. Like all of those things are real long-term possibilities. The families play a vital role because they need to encourage physio. Whether it's speech therapy or physical therapy, they need to encourage and take the people to their appointments and cheer them on, all of that, because that's really what's going to make a change long term. Maintaining a positive mental attitude is important. It shows that if you have positive people around you, your outlook tends to be more positive than if you have negative people around you.
True.
Something that people may not think about at the beginning. If you're paralyzed and you're sitting in one place or lying down in one place all the time, you have a chance of developing bed sores. And you have a chance of falling. So supporting the person physically, rotating them, checking them for bed sores, helping them to the bathroom. These are all roles that the family can do. And maybe the most important one is monitoring what got you there. Like if the person has high blood pressure, we don't want another stroke that will kill them. You want to keep checking the blood pressure, checking the blood sugar, making sure they get their medications. Now is even more important. So those are some of the way a family can help.
Okay. All right. So can you give our listeners maybe 3, because you're a fitness specialist as well, maybe 3 lifestyle changes or habits to prevent stroke? Like 3, like what would it be?
Number 1, easy. Check your blood pressure.
Right.
You want something. You want that top number to be about around 130s. You want that bottom number to be around 80s. And if it's higher than that, see your doctor. Right? I'm not saying you have to have medication. Sometimes I treat people with just lifestyle, diet and exercise, So, but check your blood pressure. Don't just think it's okay. Then, if you really want to live long and avoid strokes, eat cleanly. We're trying to avoid processed foods. So, processed foods, seed oils, like all the bad stuff, we're trying to limit that and eat cleanly and move daily. Do you know how many people wake up, walk to the car or to the driver, get to work, sit down, then stand up, get in the car, come back, and sit down again? And that's the day. No activity, right? So if you can introduce even 20 minutes of activity a day, you will live longer and reduce your chance of having stroke. Recommended is 30 minutes, but I'm telling you, you get a benefit if you just do 10. You get a benefit if you do 15. You get a benefit if you do 20. Just move. It makes all the difference. And then I guess the third one would be, avoid heavy drinking, heavy smoking, and avoid smoking altogether and avoid heavy drinking. And if you know you have chronic stress, learn some stress management techniques.
All right. So you mentioned the first one was the second one was movement. The first one was, what was the first one?
First one was blood pressure. Blood pressure. Eat clean, movement.
Movement. Yes. Okay.
Then smoking and drinking.
Okay. Some people actually think that you can cure stroke with herbal or traditional medicine. You said I'm not saying no. What would be your advice to those people who rely on herbal medicine? There's some people who swear by it. There's nothing you can tell them, and sometimes they say, "Oh, it worked," and I'm just like, What would you say to those people? Especially in a society that we are not just heavy on religion, but also heavy on culture.
I'll first start it with a story. I have a friend of mine. He is a friend. He worked for me. I've known him 10 years in this Nigeria. And he knows I'm a doctor, knows I have a hospital, knows all of that. The wife was ill. She started using herbs. She got so sick that he didn't know what to do. He now just dropped her off in my hospital. I didn't even see him. And I now go through her history and everything. Cut a long story short, probably it cost 200,000 naira to restore her back to health before discharged her. And the reason for using the herbal medication is because they wanted to save money on medication. And if they ever call me and ask for a consultation, or I don't charge them, I will just tell, hey, use this, use that, so to speak. So she burned up her liver, damaged her kidneys, all in the name of using herbs. When I spoke to her in a clear moment, I said, have you done this before? She said, yes. I said, you've used the exact same herbs before and it worked? She said, something similar. I said, so it's different? I said, how do you even know what's going in your body? And today it could be this one, tomorrow, like these leaves. There's a mushroom that you can eat all day, all night. There's another mushroom that will kill you within 5 minutes. And they look similar. So you can't be similar. It needs to be, I don't play with those things at all. But, asked about what advice I would give. I would tell people there's no herbal remedy that can dissolve a blood clot or stop your brain from bleeding. So, and we talked about every minute you delay, you lose 2 million brain cells. So, many of these stroke herbs, they make you pee or they make you sleep. They can worsen dehydration. They can drop your blood pressure. There's traditional care may help recovery, but it's not an emergency treatment. Always go to the hospital first. If time is lost, your brain is lost. That's how I can sum it up.
Okay, well, please. Like me, I think was it I was speaking to which day I said you couldn't pay me to take drugs even normally. How much more herbal drugs? Mm-hmm. Like I when I was pregnant with my children, especially my son, my second child, it took everybody around me to be like, you need to take the drugs. And even at that, because it was a hectic pregnancy, I was like, do you know what? I really don't want to take it. But then when I realized that, I think I had to be taking the blood, the red one. I hated those drugs. Oh, B complex, I think. I don't like drugs. I don't like the smell.
Well, the red one is ferrous. The red one is iron.
Like, let me just get. Is it B complex? The blood.
The yellow one. It smells strongly.
All of them smell, so it's not like one. So when I realized that, of course, because of the kind of pregnancy I had to be going to the hospital every week. And then one of the tests, and I had to be doing tests every week, every time I went. Normal human beings were going for antenatal like once a month. I had to be going every week. And one of those days, the doctor it wasn't even the doctor, the nurses had checked my blood, my blood count, and it was low. Then the doctor says, you're going to have to be taking double dose. I was like, wait, what? I took it like my life depended on it because I was just like, I don't want to die. So that's to me that it's like I had to get to the end of myself to take drugs. You now tell me that I should take herbal medicine. Could never be me.
Yes.
And I try to be healthy and I try to eat healthy, so I don't fall sick, but when I'm under immense stress, I would be under the weather. So I try to be as healthy as possible. And that's something that we don't do well as Nigerians. We eat anything, we do anything, don't move. You want to go from your house to the next street, you want to take a bike, you want to take keke. You want to go from your house to the market, which is probably a 10-minute walk, you will take keke again. And I'm just like, what are you doing with yourself? You understand? So now going to now take herbal medicine. And I think, to be fair to Nigerians, it stems from, back in the day where you take agbo for Iba, for malaria and things like that. But, hey, okay. I want to ask, these days, because people think that there are certain sicknesses for older people, right? But these days, we've been seeing a wave of young people just slumping and passing on, either through heart attack or whatever like that. Can stroke happen to young people in their 20s, 30s, and maybe early 40s?
Yes. The simple answer is yes, and it's rising. So young adults, 20 to 30, they now account for 15% of stroke cases.
Huh.
And the causes include, untreated high blood pressure. Yeah, you can have high blood pressure when you're young. Birth control use, we've talked about that. Sickle cell. Sickle cell disease makes your risk of having stroke higher. And unfortunately, drug use is on the rise. So things like cocaine, amphetamines, we have something called Colorado making its round, which is an amphetamine. They can cause, I've seen a few people mad on it that they brought to the hospital. I had to give them antipsychotic injections. I had to choke one of them just to sedate them. This Colorado epidemic, or it's too much. So, you combine that with heart defects and, some genetic disorders. Yeah, you can see it more in young people. Lifestyle also matters. Late nights, stress, energy drinks. Ooh, those are terrible. Energy drinks, alcohol, smoking, all of those things happen in young people and increase your risk of stroke.
So, Doc, what's the biggest misconception about stroke that you'd like to correct today? I'm sure you have one.
Yeah. We've touched on it, but I would like to say it again, is that stroke is a spiritual attack, right? Or it's caused by witchcraft, or somebody sent it to you.
Your enemies, your village people.
Yes, that, no, they didn't want, and you remember I talked about somebody close to me that passed. His heart failure was supposedly from a spiritual attack, which is, because he was fine 3 years, and within 3 years he was probably 52 when he died. He had the heart of a 90-year-old. And so they said, it's spiritual attack. Okay, I believe that people can curse you, but there is a medical way of treating it, so that's the biggest misconception, that, it's spiritual, you need to fight it with the spirit. I'm not saying don't pray, I'm not saying don't do, but also attack the physical, the medical portion, right? And and don't think it can't happen to young people. Some people believe, a 50-year-old is young, too young to have a stroke, because we think it's a disease of old age, right? But it can happen to anybody. Stroke is medical, it's preventable, and it's treatable if you recognize it early.
Right. Okay. Thank you so much. Finally, what's your message to our listeners, about protecting their heart, protecting their brain health, and recognizing stroke as a medical emergency, and just to piggyback off what you said, and not a spiritual attack?
Final message: protect your heart and brain the way you protect your house and your belongings. Right? So routine maintenance, routine check-in will save everything. What do I mean by that? Check your blood pressure, check your blood sugar, eat natural foods, and move daily. Get your sleep, and never ignore sudden symptoms.
Yeah, and always do your medical checkup, the high blood pressure. Always check your blood pressure.
Yes, I agree with you.
Thank you so much, Dr. Abiola. Today's was very insightful. Even me, I learned. I'm like, okay, I'm going to do this. And I also learned the signs, to look out for, so my eyes are going to be anyway. Dr. Abiola is the FA of ROA Specialist Hospital for today's free consultation and advice on understanding stroke. So if you want to consult Dr. Abiola, you want to grab a pen. Oh gosh, I hope I get the number right today, because last week it was a hot mess last week. 0913 579 5108. I'll say it again, 0913 79 5108. Now, the one that 080 888 62635.
Yay, got it.
Yes. Or you can go to the website www.broahospital.com. You can also reach him on social media, RA Specialist Hospital, to have a conversation with him. I'm go to the hospital to go and see him. Okay, Radio Doctor on Women Radio is Nigeria's first specialized radio health program, broadcast from Mondays through Fridays, 10 a.m. to 11 a.m. Join us on Monday in the new month for another edition of Radio Doctor at 10 a.m. on Monday. Many thanks to my producer, Aisha Sunny, and Miriam Kolawale in the studio. Hey, I said Gloria. Hey, Miriam. And to the executive producer, Tom Okewale Shonaya. My name is Fumi Bangala. Dr. Abiola, thank you so much for coming on the show this morning.
My pleasure. Have a good weekend.
You too. All right. You can stick around with us, WFM, for great conversations, great shows, great music to, help you start your weekend early and help you start the new month early. Do not go anywhere, but catch you same time next week for Radio Doctor. My name is Fumi Bangala. Do have a lovely day and a lovely weekend. Happy New Month in advance.